Hello, and welcome to Raider HQ After Dark. I am your host, Raider, and today I'm bringing you another change to the VA M21 manual. And this time it has to do with manual reference 4.1.3.B.1.c right here. And this particular manual reference change has to do with how medical opinions related to hearing loss are performed. And this specific change occurred on April 28th, 2025. Now, this particular change to the manual is also what I would consider a good one, in my opinion. And the reason why is that we had this before this change. What would happen is if the examiner reviewed the hearing loss and independent of whether or not you have hearing loss for VA purposes now, what would happen is the VA examiner would take a look at your entrance exams and exit exams from service, and they would use those two particular exams to determine whether or not you had what they consider a noise trauma. So if your hearing was semi-normal upon your onset into service and it was semi-normal on your exit from service, then they would deem that there was no actual trauma that occurred in service to give you the disability that you have, or effectively the hearing loss that you have now. So that's how they were going about actually kind of that's their medical rationale for why you're not service connected due to hearing loss. And this particular manual reference, it actually challenges that. So it's making the examiners have to go through and provide a detailed rationale for why the hearing loss is not related to service. And they can't use that kind of, you know, noise trauma or lack of noise trauma as their rationale. Should not solely discussed that hearing loss was normal at times of the veterans enlistment and separation. So this is a huge win for the veteran community because this was top sheeting at its highest level for hearing loss, because they would just jump to that and lazily say, no, you're denied. But because we've done this change, raters now have to hold the examiner's feet to the fire and say, okay, well, if you're going to take that approach, you have to provide a rationale for why it's not true that their hearing loss was due to service. And you'll have it in situations where, like, the veteran was on the flight line, or, clearly having the noise exposure and the noise trauma that they so easily discounted. But anyway, so this particular manual reference change has to do with, just making it to where the examiner takes the whole balance of the evidence into consideration. And they have to go through and do due diligence if they're going to deny or grant, which, like I said before, is a big win for the veteran community because it makes them have to explain themselves. And you can use that explanation that they provide in your, appeals, because if you can find evidence to refute something that they said, then that's how you can overcome your denial. And then it goes even further and commands that the raters will not just simply deny. So the raters can't top sheet anymore either and say, oh, well, they just said it was denied. So moving forward after the April 28th change, the raters have to look for sufficiency. So they have to hold the examiners accountable to having a very detailed rationale for their medical opinion to deny and to grant effectively. So that's pretty much it for this manual reference change. Let me look up here real quick and see. The second part of this is actually an improvement too. It's saying that whenever you have a disease process type arthritis, not a post-traumatic arthritis, that we don't need x-rays in order to confirm a diagnosis. That was something that was a real problem up until recently, because there's a difference between how the medical examiners consider post-traumatic arthritis or like I jammed my leg, which caused the arthritis, or I had a trauma to my knee and that caused my arthritis, versus having like psoriatic arthritis, which is considered by VA standards as a disease arthritis, which can spread to different joints. So historically, you had to have an X-ray to confirm it, which was discriminatory in some cases because, if you can show that you have this chronic disability of, say, psoriatic arthritis, there should be no need to continue to X-ray the person indefinitely to determine whether or not that is the condition, because it might not be confirmed via x-ray. We might have other diagnostic imaging that is used to come to the conclusion that the disease, arthritis, has spread to another joint. So this is another, it's kind of a niche win, but it's still another good change to the M21 to allow for veterans to more easily get, service connected for the spread of degenerative arthritis. And it also reduces the amount of need to delay the claim in order to defer back and have the examiner take that x-ray, and then the time it takes to do all that inconvenience the veteran, because obviously they have to attend the x-ray and then send it back to us to have something that is already conceded be conceded yet again. So once again, this is another positive win for the veteran community. So that's about all I have for these manual changes. Once again, they're a little bit on the older side, but I'm kind of going through within the last 6 months and doing videos about these changes, and just kind of parsing them out as I come across them. But anyway, so that's it. Thank you, and Raider out.